Hi runners, today we're going to talk about osteoarthritis in the big toe joint, which causes pain and increased injury risk for many runners. And we're going to look at the implications of this problem and look at the evidence for the treatments that we offer in the clinic. This is Steve and Doug from Intraining Running Center at Toowong. Our goal is to give you the best advice on running injuries, footwear, and training to keep you running. So Doug, I had a patient this week who came in with pain in the first MPJ, which is the big toe joint.
Yeah.
And it wasn't really bad pain. It was sort of more of a mild pain, but it was sort of constant. And she had a big race that she was wanting to train for. It was actually an ultra race. And so we had to sort of find a way to try to make it so that wasn't hurting so much. She was worried about long-term implications. So even though the pain wasn't really bad and she was still able to run, it was sort of aching all the time. And so she was worried about what would happen down the track. How often have we seen patients in the clinic with big toe joint osteoarthritis, do you think?
Yeah, look, it's probably one of the top 5 issues, I guess, we would see on a regular basis. In general populations, maybe sort of 1 in 5 to 1 in 6 people that will have it, but unfortunately, I guess runners, particularly, as the trend is these days, ultra runners will tend to be on their feet for a bit more and put a bit more stress and force through your feet than what a lot of people will do.
And osteoarthritis is sort of also called degeneration of the joint, but there's different sort of causes for that, isn't there? Sometimes you've traumatized the joint from an injury when you're younger. Sometimes it's a chronic sort of micro trauma that occurs over time. What's the implication for when you get that osteoarthritis? What's the progression of that injury? Yeah,
well, unfortunately, it is a bit of a process. So once you've got sort of the early changes, if not managed well, and that's a key part of what we're going to talk about today is the management, is you start to see some changes in the toe joint itself. So looking at the big toe joint here, one of the first stages that we'll see is basically a thickening around the joint. So generally it gets a bit harder to fit your foot into some shoes. You start to get a bit of achy pain around the sides there as well. If that's sort of left, or sort of the trauma continues, or things haven't changed, so footwear can be a real irritating factor. You'll often get a bit of tenderness and soreness on the side of the toe joint there as well, or a bit of bursitis. If that persists, so on the top of the joint, we'll start to see a bit of thickening, and then you can end up with a bit of a locking or a reduction in movement. And depending on the cause of it, you might start to see the second toe joint starting to shift across, the first toe, the big toe, starting to shift across towards the second one. Generally, you're going to start to see a bit of instability in that case there. You can then start to tuck under it, and you can also get a bit of a rotation as well. So what would call HAV, or hallux abductor valgus. So it's basically a rotation and a movement away from the normal straight toe position there.
Yeah, and so the pain that people have initially, as the joint sort of starts to degenerate and you get spurring around the joint, which is sort of bony, sort of extra bone sort of laid around the joint, and it's sort of leading towards fusion of that joint, and so that can be like every 6 months you have pain for a few weeks with that as it sort of changes. But a lot of the pain is actually the bursitis that you mentioned before, because as your joint gets bigger, the pressure from the shoes just gets more and more focused on that spot. So
and shoes can certainly trigger that pain and make it worse if you're not conscious of it.
Yeah, I know the ASICS logo used to have a stitching going across that joint. None of them do now. But it used to cause problems if you had this the bunion at the big toe joint. What do we need to do you think, to try to reduce the chances of this being an issue for runners?
I guess you're dealing with it in sort of the acute phase. You've got to try to calm it down a bit. So, I guess identifying if there's a particular shoe that does it. So for certain people, it'll be their work shoe. It'll be too tight, too narrow, too shallow, which puts more pressure on the joint. For runners, it could be that you got the ghost there.
I do.
The fit might not be quite adequate, so if it's not broad enough there, it might be rubbing, but equally it might not be that the shoe's quite suitable, so it might be a bit too unstable, there might be too much movement inside the shoe, so it's quite a few different footwear factors there. Equally, as the toe joint starts to stiffen, I find that if there's too much flexibility in the shoe, sometimes that can be a problem as well. There's certainly been some studies lately that have looked at how much flexibility a shoe has can sort of have a bearing now. Whereas we compare that to the Hoka shoe there. So
this is the Carbon X3, which has got a carbon plate through the sole, so you can't really bend it at all. No. But it's got this huge rocker. You can sort of see that it has sort of a bowl shape at the bottom, so it's really easy to roll off the toe.
Yeah.
So it actually stops the big toe joint from flexing, which is one of the reasons why super shoes are more efficient. And obviously if it's not flexing, then it's less chance that it's going to get that micro trauma.
Yeah. So I think it's a really good treatment option that wasn't really available a number of years ago.
Yeah, so if we talk about this problem with regards to how often we can get a result, like the research on our interventions is not always 100% when it comes to orthotics. As we said before, there's a little bit more with shoes. Yep. But what would we do orthotic-wise to try to offload it?
Really depends on the foot. You know, everybody's got a slightly different foot, so we can't say there's a one-size-fits-all approach, and that's where sort of going into a chemist or a sports store and buying an insole off the shelf is not effective. No. They have found that if you get a custom supportive insole, it does reduce the amount of pressure that goes through the toe, so that's a really helpful first step. There's other features we can do. For some people, it's just actually trying to improve the movement of the joint. Others, we need to actually try to work to stiffen it up. So there's certainly a number of treatment approaches there, but it all comes down to what the individual's presenting with in their foot site, what they're doing exercise-wise, and what they're hoping to do, I guess, as well. Yeah,
certainly the patient I saw this week, we just got her into a pair of these shoes, and that immediately had stopped hurting when she was running in these shoes compared to her shoe that had more flexibility. I have had another patient earlier in the year that actually had surgery on this joint because there's a lot of deviation, and the plantar plate had actually ruptured. So
that was the toe joint on the patient that was deviation?
Yes, that's right, yeah. So the toe had deviated, and the plantar plate, which is like a little supportive mechanism underneath the big toe joint, it was actually in the second toe joint, had ruptured, and it's a common problem, plantar plate ruptures for people with this big toe joint osteoarthritis. So he ended up having surgery and is now back running under 20 minutes.
That's
for
great.
5K again.
Really good outcome.
But I mean, really what we try to do in the clinic is to slow the progression of this injury so that surgery isn't required.
No, and it's not often that you'd be recommending surgery for someone, is it?
No, that's right. Really what we try to do is sort of do everything we can to avoid that.
Yep.
So if you're having problems with your big toe joint and you want to get it checked out, come in to see us at the clinic, and we can give you an assessment of the big toe joint and look at the different treatment options that might help either slow the progression or reduce the pain if you're having any problems.
Yeah.
All right, so thanks for joining us for today's Run Talk, and we love running.